The saying goes that the best way to learn is to teach. Here, in part 3 of our series with Dr. James Bateman from the Coventry and Warwickshire University Hospitals NHS Trust, we talk about the benefits of encouraging students to develop their own virtual patients.
Hear what you say about capturing the informal vignettes. Students making their own virtual patients. After all, they're seeing patients all the time, real patients.
I mean, that would be the ethos of sort of Web 2.0, you know, getting the students to generate content. There's a whole minefield of issues about consent with students generating cases that could potentially breach patient confidentiality. But I don't think that's the main issue. Students could be encouraged to generate cases based on what they've seen that are separate from what they've seen, and they could learn from each other. Because not cases around necessarily a specific patient, but around concepts, about things they may have missed, about things they didn't quite understand, and then generating a case that explores if other students have that problem or other students, you know, see things in a different way. So really, it would help the students learn from each other, it would help them learn about how they think through these sort of clinical problems. I think it would also stimulate the students to think about reading more into an area. So if they were going to generate a case on COPD, that's when they might then review the literature and come up with their own sort of ideas about, you know, how the case could be generated. I found it a very useful experience reviewing literature. When I've been creating patients, it makes me think, what is the evidence behind what I'm saying? And I need to go and look at it because, you know, I'm writing something and it's important that that's correct. I think the students will feel the same way.
There's a cliche, and just because it's a cliche doesn't mean it's true, that the best way to learn is to teach. So perhaps this would be a good way for getting students to get a much more integrated set of thoughts around an individual clinical case.
You're right. I think that if students had to generate some content, they themselves would know if they didn't understand it. So if they were writing about, you know, what treatment should be prescribed in a certain area, I think the students would know what they didn't know. It would really prompt them. I'm not saying it would force them to go and learn it, but I think it would really highlight to them what they don't know, rather than just, it makes them think about the case in a more focused way. You can't say that it would make the students actually do anything about it, but I think, you know, it's bringing to their attention areas in their knowledge about, you know, the pathogenesis or the treatment of a condition that they could then, you know, then target their interest. And I think if they're interested, they're much more likely to learn.
For further information about the eViP programme, please explore the eViP website. And for news and updates, you can follow us on Twitter on www.twitter.com/virtualpatients, or you can even join our Facebook group at www.facebook.com/virtualpatients.